Welcome, everyone. We're piling into this room. That's great. So let me just begin by introducing Radhika Sawh, who is one of our newest team members on the NYMAC team and has been a force in trying to get all of our all the teams in the territories and in the continental US working and thinking together. Has been quite wonderful. But she comes to us with quite an excellent background. She's a board certified genetic counselor. She works in New York. She has an undergraduate degree in biology and psychology from Boston College and was trained at the Human Genetics program at Sarah Lawrence. But prior to coming to her professional roles at NYMAC and at Sarah Lawrence, she worked in a high volume prenatal setting as a clinical genetic counselor, but she also had a really important role. She was the national director of patient services for the Cooley's Anemia Foundation. And understandably, she has passion for outreach and advocacy, particularly for individuals and families who are living with a hemoglobinopathy. So welcome, Radhika, and make us smarter on this issue.
Wow, thank you, Luba, for that kind introduction. Erica, should I get started or should I wait a couple more minutes just to give everybody a little time? You let me know.
We are here. You are. Go ahead and take it away.
Attendees. That's great. Go for it.
Okay. All right. I'm just going to make sure my phone is off because I don't want any disruptions while I'm talking. So thank you guys so much for joining me today. I'm very excited to share with you some thoughts that I do hope will be helpful for those of you who are living with chronic health conditions or genetic disorders or complex medical needs when you find yourself in the ER. So I have a unique perspective, as Luba sort of alluded to. I am a trained genetic counselor, and I've had a very different career path compared to most of my peers, in the sense that I worked in the advocacy space for a couple of years, and I'm still actually very highly involved with them. I'm on the board of directors still with the Cooley's Anemia Foundation, and I still work to try to build awareness and advocacy for people living with different forms of thalassemia. So, and I also bring to you my personal experiences, because not only am I a genetic counselor, but I'm also someone who is living with a chronic health condition that is genetic in nature. So I'm hoping that because I can wear both hats, both as a professional and as someone who lives with, chronic healthcare needs, that I can give you both sides of the story and that we can learn from each other today. So I do hope this is going to be an interactive session. I really don't want to hear myself talk too much, but I know I do have to talk a little bit. But I hope you will also share with me, and so we can learn from each other. So I do have to start by sharing my financial disclosures. I have had the pleasure of doing some consulting work with Bristol Myers Squibb, for which they did pay me honorarium for my time. So to begin with, I really thought it would be helpful to just sort of figure out who's in the room with me today. So my friends here at Erica Mark Productions is going to pop up a quick poll. And I just ask you to please select the category that best represents you. How do you identify? Are you a self-advocate? Someone yourself that's living with a condition like me? Are you a family advocate, parent, a grandparent, an aunt? Are you a genetic professional? Are you another type of healthcare professional? And I tried to be inclusive of all the different degrees here, but there's also allied health professionals. We're very grateful for all of you and what you do. Do you work in the public health, or are you someone different? And if you're someone that doesn't fit into any of these categories, you're equally welcome, and you feel free to identify yourself if you wish in the chat. Yes. Hi, Cindy. So glad you're here. Yes, she's like me. We wear more than one hat, and that's great. Thank you, Cindy.
Got most of your answers coming in here. So I'm going to close the poll in 3, 2, 1. Now you can see the results here.
Okay. So it looks like we have a lot of genetic counselors here, which is great. So nice to see so many of our peers here today. Thank you. And I'm glad to see we have some self-advocates and family advocates here and some health professionals as well. So thank you so much. Some people from the public health sphere and some who are others who maybe like Cindy and me wear multiple hats and didn't feel like you fell into any one category. No matter what you answered, we're really happy to have you here with me today. We have another quick poll. Just again, I just want to understand, what is your experience with advocacy, particularly in the healthcare setting? So another really quick poll just to get an idea. Have you ever advocated for yourself or for a family member? Are you an advocate yourself? Have you ever used a formal patient advocate, someone that's provided by the hospital or a support group, or have you used an informal patient advocate? Or again, other. Does none of these really qualify to best describe you, and can you share if you're willing? So Erica, I realize we need Jeopardy music in the background.
I know, yeah. Or you just chatting away. You can kind of guess what's out there or speak to your own experience. We have about half the people answering so far. This is a little bit longer for people to read all the responses.
We'll take another maybe 30 seconds. Yes, Erin, I'm so glad to see you here. And Erin, I am not surprised of your response. And yes, I imagine many of you as genetic counselors do advocate on your patient's behalf. So.
Okay, I'm going to close the poll in 3, 2, 1, and here are the results.
All right, so it looks like a lot of people have either advocated for themselves or a family member, and some of you have actually used a formal patient advocate. So it'd be interesting to hear what your perspectives are. And we have some that have used family and friends, some who are different, and some who've never had any experience with advocacy. And you in particular, we're really happy to have you here today because it can be overwhelming to have to be in that role. So we hope that you'll leave this chat with some new tools. And for those of you who have advocated in the past, we hope that you'll gain some perspectives and also some additional tools for your use. So thank you so much for participating in today's poll. So I'm going to just get started and let you know a little bit. I thought it's important to just start with a little bit of background. And I think it goes without saying that going to the emergency room is a stressful situation for anyone and everyone involved, right? No one wants to be there. But it's particularly challenging for someone who is living with a chronic medical condition, who spends a lot of time managing their complex medical issues. That particular patient is often in great stress and pain and really was doing their best to avoid being in the emergency room. Oftentimes that is their last resort. They will try everything under the sun to avoid having to end up there. But if they do find themselves in an emergency room, they're often at their wit's end and have tried every remedy and every resource and are showing up in great pain and in a lot of distress. So they're looking to find someone to take care of them who is not only empathetic to what they're going through, but also knowledgeable. And they want to find someone who can address their concerns both quickly and competently. The ER staff, on the other hand, are often juggling several patients at once, all with varying needs and priorities. ER staff must be able to care for patients with all types of ailments. And oftentimes, I think we, as the people going to the ER, assume that they must be aware and knowledgeable and have capability in all areas, in all departments in medicine. And unfortunately, that's not entirely true. And that's not to say that they're not incredibly capable and proficient, but their expertise is actually focused on immediate management needs of different conditions and determining very quickly whether a specialist is needed urgently, routinely, just for follow-up, or not at all. So making that kind of assessment and figuring out where the specialist needs to be involved is very important for them to be able to do efficiently. And if they make a mistake, not only can that be costly, but in the worst case scenario, that can lead to additional complications and potentially prove fatal. So it's really important that those working in the ER have the ability to quickly assess and stabilize and treat patients. And most times they have to do this without having the ability to consult with the specialist, because time is always of the essence. And in many cases, they have very, very little information about the patient. So you can imagine if you're walking in the emergency room and you have a condition that's quite rare, or you have multiple symptoms and conditions happening simultaneously, that can present a great challenge to a physician in the ER or the nurse or whoever is doing the assessment, and try to figure out what is going on and how can they best assist you. So it's not going to be possible for those working in the ER to have great knowledge of every condition that's out there. As we know, there's hundreds and hundreds of conditions. I would say thousands is probably more accurate, each with different needs. So we need to flip the table and then make ourselves the experts so that we can assist in this type of situation. But, the way we're going to be able to prepare ourselves is by first understanding what is not happening, what is going wrong. So here we're going to pop up a quick Mentimeter, and I just want to hear about what has been your frustration. What has been the biggest frustration you've had with emergency room care? Because again, in order to correct the problem, or at least try to tackle this issue, we need to understand what's been the frustration. Where are you hitting your head against the wall? So I think Erica is popping up a nice link here to the Mentimeter. So if you're able, it'd be wonderful if you could just share your thoughts. It's open-ended. Just, there's no limit, but maybe in a few sentences, what's been your biggest frustration with the care you've received in the emergency room, so that we can figure out how to move forward from there.
And
Yeah.
As Radhika said, the question is in the chat there. And Radhika, I'll take over your screen sharing to show the results.
Sounds good.
They came
Sounds
in,
good.
and the first one, I'll tell you, the first one came in and just sat there by itself for a little while. I think you'll appreciate it.
Believing me. Oh, I hear you. I can appreciate that. Yeah, rushed and inaccurate triage, wait times. I saw that was also in the chat. Wait time, being listened to, having resources for families. Wait time, wait time, wait time, wait time, wait time. Yeah. So not being heard by providers, wait times. Yeah. So getting an answer from the provider or physician extender, how much will this cost? Yeah. So obviously wait times is going to be one that's going to be a little more challenging for us to tackle, but I think there are some of these other concerns that you have that hopefully we can assist with today. So yes, having the medical provider not view you as knowledgeable is challenging. Fighting for imaging, yes. And then they worry about radiation. Again, it's just the lack of necessarily knowledge and realizing, no, sometimes the imaging is worth it. And the amount of radiation you're going to receive from a quick image is negligible in the long run if it means getting a diagnosis, especially if you have a child that's sitting there with fractured bones, especially for those people who have different forms of, say, OI and all that. Yes, not believing, that's a huge one. yes, getting pain relief. I know that my friends with sickle cell disease suffer from that indignity often, saying that I'm in pain. You need to realize that is the first and foremost thing you have to worry about. So yeah, I appreciate that. And I see there's also another comment in the chat. Yeah, again, confidence that the providers know about the rare condition and what's the appropriate workup. Yes, absolutely, absolutely. And yeah, oftentimes the cost can be concerning too. So thank you so much for sharing this. I appreciate that. So Erica, we have one more question. So before I go back to sharing my screen, or I mean, I can momentarily if that's helpful, but the next question I wanted to ask is about what strategies have worked for you. So Erica, would you mind popping that Mentimeter back on?
Okay, it should be.
Bye-bye.
Oh.
I can go back to sharing my screen.
Should be able to advance the questions.
Okay. So hopefully those who are on the Mentimeter, you can see that there's another question. And what we want to know now is, given those frustrations, have you figured out any strategies that have worked well for you? And Erica, feel free whenever you're ready.
Yeah, I'm looking at this. I think I may need to post in a new link to get the answers to that.
Okay,
So
no
I'm going
problem.
to just post a refreshed link and see if that works. I was going to put that in chat right now.
And it's okay if we don't have the strategies yet. And that's what we're trying to work on. No, I'm just saying. And I appreciate that you're doing that. Yes, and I see Barbara. Barbara's already, a step ahead of me. And yes, brought condition, disease information with you. Yeah, that's a big one, because unfortunately, we're going to talk about that. That can be an issue. So Erica kindly posted a new link to a Mentimeter for you guys to share some strategies that have worked well for you.
All right, we are starting to get those answers in now.
Okay, feel free to take over whenever you're ready.
Take over your screen share.
That sounds great.
You ask such thoughtful questions. It takes a
I know. Absolutely, absolutely. Yes. Oh my goodness. Yes. I think, Erica, this might be not the exact question, but that's okay. So some of the strategies that you've used is having medical records, having a letter from the provider. Yes, like a cheat sheet. Exactly. Essential medical records.
Yep.
And yes. And yes, exactly. When it's amazing sometimes on a patient side, you expect the doctors to be much more knowledgeable about things. And sometimes their medical literacy can be less than yours, but that's because you have the experience on your side. Yes, having the binder, that's another one. Yep, these are great. These are wonderful. So Erica, I can probably pop back on now and start to move forward if that's okay. All right. So thank you guys for sharing that. So I'm going to go back and share my screen. Hopefully you can see my slides again. Are we good with that, Erica?
Yes, looks great.
Okay, great. So thank you so much for sharing some of your strategies, and those are some of the ones you will hear about in a little more detail just now. So I thought the first thing we should do is just define what I mean by self-advocacy. So self-advocacy refers to an individual's ability to effectively communicate, convey, or negotiate, or assert his or her own interests, desires, needs, and rights. So what it is involving understanding your own strengths and needs, identifying your personal goals, knowing your legal rights and responsibilities, and communicating those to others. So that sounds like a lot, but in a nutshell, what it means is just that being a self-advocate means that you can speak up and represent yourself to ensure your needs are met, right? That's pretty much it in a nutshell. And it's a critical skill for individuals, particularly for those living with genetic or chronic conditions, whether you are in a doctor's office, but particularly when you're in an emergency room, to make sure that you receive the appropriate care. And I think it's important to appreciate that self-advocacy is difficult for anyone. It's not easy to do, but we appreciate that if you have more complex needs, it can feel even more daunting. So I'm hoping that you will leave here today feeling a little more empowered in how to do it for yourself or for others, because these strategies can work whether you are doing it for yourself, for a family member, or for a patient. So for my genetic counselors in the room, thank you for joining me today. And maybe these are strategies you can help share with the families you work with. So first and foremost, we need to educate ourselves. You need to become the expert in the room. And the way to do that is to become knowledgeable about your healthcare condition. So, I think it's important to keep in mind that depending on how rare your diagnosis is or the diagnosis of your loved one, it is quite possible that the medical professional that you encounter in the ER may have very minimal knowledge about it. They may have only heard about it and learned about it during their professional training, whether they're in medical school or nursing school, PA school, whatever, or even, whatever specialty they're in. They may have just heard about it during a lesson, and that's it. So they know it exists, but they may not know much more beyond that. And I know that can be incredibly frustrating. As we said, you expect the people on the medical side to have this amazing, thorough literacy, but sometimes that's not the case. And we have to just acknowledge that. We have to just go in and say, I have a rare condition. You probably have never heard of this. And if they have, yay, your life is that much easier. But be prepared that they're going to look at you with a little confusion, or may even look at you and say, but I didn't think you could live this long, or, have preconceived notions, because that's the other problem, is that sometimes the medical textbooks and the lessons don't represent what today's situation is for that condition, because treatments change. So what you can do is learn as much as you can about your diagnosis so that you can speak knowledgeably about it with healthcare professionals. We recommend researching your condition online, but you have to use reputable sites, such as the official websites for conditions, or government sites such as the CDC or Medline. Those are really good sites to do it, or through like official support groups. Like for instance, I can talk to you for thalassemia. We have a medical advisory board to make sure every information that's on our website is vetted by people who are, well versed in this condition. So that's something to look into. But what you really need to do in particular is make yourself aware of how your particular diagnosis may impact your emergency care needs. Is there any particular symptoms that you need to be mindful of? Is there any treatments that are really critical that you get if you find yourself in an emergency room situation? So those are things that you really, really need to know. And yeah, it is true, Lynn. Yes, and thank you, Cindy. NORD is an excellent resource as well. And Lynn, you're right. They often want to go down the diagnostic rabbit hole with you, but you can save them a lot of time and energy, and you a lot of cost in the long run if you're like, listen, this is the diagnosis. And we're going to talk about in this next slide how to hopefully, curtail that, travel that they do. But what you really need to know is that, if you have a diagnosis that says that because you have X, you cannot take Y medication, you need to be upfront and tell them right now. If you're not able to use anesthesia because it has side effects that are specific for your diagnosis that can be detrimental or even fatal, you need to be able to convey that information. And what's really helpful too is being able to speak in the language that medical professionals use. So if there's certain language that's commonly utilized, medical terminology surrounding your diagnosis, learn it and speak in their language. Because I will tell you, when you start using the terms they use back at them, they pause and they look at you and they're like, oh, you know a little more about this than the average person. And you're like, yes, I'm living with this. So when you can speak in their language, it really changes the whole dynamic in the room and they start looking at you differently, you know? So even saying something like, instead of high blood pressure, hypertension, right? Just using that lingo makes a big difference. And of course, this was brought up before, it's important to know your insurance policy. And insurance can be daunting, but just try to understand the broad strokes of it so that, you know, cost issues can be limited whenever possible. So when it comes to knowing your diagnosis, it's really important to know your precise diagnosis because, again, that can also make a difference in terms of treatments and different tests and imaging they may want to do. So, you know, just saying I have muscular dystrophy is not particularly specific. We know there's many different types, right? There's Duchenne muscular dystrophy, there's Becker muscular dystrophy, et cetera, et cetera. So being able to specifically pinpoint what you have can also help to just help them better understand how to best treat you. And it's really, really important to keep records. I know some of you mentioned about having a binder or binders full of records and detailed information. Now, that's great. And that's something we should have just at home. We should know, you know, keep track of what's been done so we can avoid repetitive testing when it's unnecessary. You know, you should have, it's impossible, especially when you have conditions where you're getting tested all the time, necessarily to keep every piece of lab work that you have, but keep the relevant ones. Keep a spreadsheet. Excel spreadsheets, Google Sheets is another great way to just keep track of things. But what you want to do is keep like hard copies of our really important stuff, like the diagnostic testing you have. If you've had genetic testing, that report should be something you have and hell, laminated, right? Something so it won't be destroyed, so you have it easily accessible. If there's certain treatments that you started, if you're on a protocol on a study, that's something I was on. It's important to have that documentation to be able to share that. But, you know, we can't always walk around with our binders with us, especially when you're running out the door because you have to take your loved one to an emergency room. So the better thing to do is to create a concise medical document that you can have handy and ready to go at all times. So that document should have certain information on it, but again, it should be brief and concise. You cannot expect the people in the ER to read a binder. You may have it, and that's wonderful that you have it, but they don't have the time, and we have to recognize that. So if you have a one-page or at most two-sided document that you can hand them, that would be great. And that should be something that they can keep and then add to your chart. Don't ask for it back. Have copies of it, but it should have your diagnosis written. And if you've had genetic testing, have your genetic mutations or variants written on there. It should have your current medications, and on that, it should also include the dosage that you take. If you're taking 500 milligrams versus 5 milligrams, that's important for them to know. Do you take it 3 times a day or just in the morning? That should be on there. It's imperative that you have on there any allergies you have or any things that, like I said, for instance, anesthesia, if you're not allowed to take it, you must have that written down. Again, it'll save you time and ensure that you don't get any treatment that can be detrimental to your health. You should have also on there emergency contacts so that if for some reason you're unable to speak for yourself, they know who to reach out to quickly, right? This has to be kept updated. So a great tool to use is your phone. We all have cell phones now, and that could be a tool that's on your phone so you can keep it updated there. And then again, it's always good to print it out. I personally have done this for when I've had to advocate for my father and now for my father-in-law, because they were on multiple medications, and I had a list ready to go anytime I went to doctor's appointments or the few times I had to go to the ER. I had that paper ready with me. I grabbed it out the door. I knew exactly where it was, and I was able to grab it, and I handed it to the people in the ER, and they looked at me and said, "This is wonderful. can I keep it? I said, it's yours. I have other copies. And then when they made changes, I made notes, came home, fixed the sheet and printed it out and had it again, ready to go. It makes life easier in that stressful situation, because also you may not remember everything in the heat of the moment. You may have forgotten that there was a drug change recently. You may have forgotten that, wait, no, he does take this 3 times a day. So that is a really important thing to be able to do. Another thing is, some of you may remember they used to have medical alert bracelets. That was particularly for people if you had an allergy for something. But now they have electronic ones that I've found that you can do that have one is called My ID Hive Medical ID bracelet. And I'm not promoting any particular one, but it's just another example of something you can have that they could scan. Now, not everybody in the heat of the moment will take the time to necessarily scan a QR code and go to a website or look it up. That's why I'm saying having a paper document you can hand to someone just will make your life easier. Trust me, I've done it. It does make a difference. And remember, of course, you'll always have to have a photo ID and your insurance card on you at all times. But I promise you that medical document can be really life-saving and can save time as well. Another important thing I strongly recommend is whenever possible, don't go alone. I know that's not always going to be something we can do, but it would be wonderful if you can have someone that you've already put into place, and not just one person, maybe 2 or 3, and say, listen, if I ever have to go to the emergency room, can you be the one to come and join me? Because, you know, you may not be in a position where you're actively able to communicate for yourself. You know, you may be in extreme pain, or you may just be, you know, just otherwise distracted, and you just need someone who can be your voice. And that should be someone who you trust implicitly, someone who is a family member, a friend, right? We can't expect our doctors to drop everything and to run to be with us, you know? So you really should have someone that is easily accessible to you and that will do that for you. So make sure they understand your medical history. So this is someone that you obviously have to have a good relationship with and that you trust with this personal information. So there's someone that also should have access to that document I've talked about. And there's someone that you trust so much that you would say, hey, ask questions on my behalf, because that's what you want them to do. Because if you're not thinking clearly because of, you know, you're in pain or maybe for what other reason, they can be the ones asking the doctors, why are we taking this medication? And again, let me remind you, this is their diagnosis. This is the treatment they're on. So, and they can also take notes on what's being said and what's being done, so that if you are, you know, in and out of consciousness or in and out of a capable state, you can know what's been happening. But quite honestly, if you're lying there and something gets critical, they're the ones that can go run and get help. But more so than that, they can provide emotional support, because those long wait times are challenging. And you want someone that's constantly going up and talking and saying, when are we going to be seen? What is going on? And be able to advocate for you. And quite honestly, they're the ones that can get the nurse's attention if needed, if you need to go to the bathroom, or if things are suddenly getting downhill. They are really important to be there. So, yes, Lynn, you're absolutely right. If there's certain needs you have, that can also be put on the document that we spoke about before, if you have specific needs. We'll talk a little bit more about that in a couple slides, but yes, thank you, Lynn, for bringing that up. So it's really important when you're advocating for yourself or for others to speak up. You know, don't be afraid to speak up. You have every right to say what's going on and ask questions. If you don't understand what they're doing, or the test you're taking, or why they're doing it, ask. Say, please, why am I taking this test again? Why are you drawing this blood? What is going on right now? What are we waiting for? Why are we not starting treatment? Ask. But, you know, it's just, we have to be respectful and be polite and realize, again, they're juggling a lot of patients, but it's okay to ask questions, you know? And if you feel like you're not getting the care you need, again, speak up. Let this medical staff know your concerns and ask for what you need. So it's really, really important to, when you do speak up, you need to be clear about your needs. And when you're talking to healthcare professionals, again, time is of the essence. They don't have the time to sit there and hear your whole story. For us as genetic counselors, we have that luxury when we're with patients to like sit and listen and just let them share their story and be a part of their narrative. In the ER, that's not going to happen. You have a few minutes with them at most. So you got to give them broad strokes, big points, take home messages. So when you have to explain your medical history, unfortunately, while it's an important part of your story, they don't have the time to hear about the diagnostic narrative. They need to cut to the chase. What do you have? And how is that impacting why you're there today, right? So you need to be able to speak and be precise in your words and be concise. So keep that in mind when you're speaking. And this goes to what Cindy, I think, or Lynn, no, sorry. I was trying to keep an eye on the chat. Yes, Lynn brought up before. Remember, you can ask for accommodations. The Americans with Disability Act requires that healthcare professionals provide reasonable accommodations. So that can be a quiet room. Like if your child has behavioral issues or issues and the noise is going to be so distracting to them, you should be able to say that. Listen, you're just going to make matters worse, keeping my child out here in the chaos. You need to put us in a quiet room. If you need a sign language interpreter or a language interpreter or a translator, you need to say that and they need to find someone for you. It's not fair to have your family member or friend do that for you. They need to have a professional one, because sometimes the language that the medical professional is using may not be familiar to the person you have with you. So you need someone who can definitely interpret if needed, and that should be provided for you. That is your right. So you should be aware of that. Speaking of rights, you should know that as a patient, you have certain rights. So the Patient Bill of Rights is an evolving document that was adopted, actually, 50 years ago in 1973 by the American Hospital Association. That bill has since been updated, revised, and adapted for use throughout the world in healthcare settings. So unfortunately, there are different versions of this bill, so I wasn't able to show it to you for one to just refer to. But in general, these are some of the big take homes that are included in there. And that includes the right to accurate and complete information, fair treatment, and the right to participate in decisions about your medical care. You are supposed to have the ability to do informed consent. So you should not be getting any treatment that you do not wish to have. If you are, yes, by the way, I'm looking in here. Yeah, a child should not be ever giving a diagnosis because there's no one in the room to do the translating. But yeah, as a right, you have the right to access your medical records and say, wait a minute, what are you doing? I want to see what's happening right now. You have a right to ask questions, and you have a right to say, no, I don't want that treatment. I've had that before and it has very bad impact on me. I don't want to do that. And if you say no to a treatment, that doesn't mean they throw you out the door. They have to offer you an alternative. And if they can't offer you there, they have to give you transportation to a place that can. So you have to be aware of that. Stand up for yourself or for your loved one, whoever you're with, and make sure you know you have rights. You are not forced to get any treatment that you don't consent to. The only caveat to that is if you're unable to give consent and it's an emergent situation and they are like, this is a life or death thing, we have to do something now or this patient's going to die. But if you are cognizant and able to give consent, you should be permitted to do that, and you have to be given the time to ask the questions to understand what you are consenting to. Finally, it's important to follow up. When you finally are done with that unfortunate visit to the ER and you're back home, again, make sure you schedule a visit with your primary care, your child specialist, pediatrician, whoever it is that manages your needs, and make sure you talk to them soon after your discharge. You need to tell them what happened, how come you ended up in the ER, and the care and treatment you received while you were there. And this is a great opportunity to clarify, like, wait a minute, they now say I have X. I didn't know this was an issue, or they noticed Y. Find out what concerns they brought up. These might be new to you. And this is where you have the time to have the longer conversation with your primary care or your specialist and find out what's happened, what's going on, what are the next steps now? Are you going to be on a new treatment regimen? Are we adjusting it, the old one? Is there a new diagnosis that now we have to wrap our heads around? This is where you have that opportunity. So here it is back in summary. So you need to educate yourself about your diagnosis so you become the expert in the room. You need to know your precise diagnosis so there's no confusion, because there are many conditions that have overlapping symptoms, and there are umbrella terms that are being used for conditions when there are more specific diagnoses that have specific needs. You should have records that are yours at home to keep, but you should be prepared with a single page document that you can give that highlights the important things that an emergency care physician needs to know, such as your exact diagnosis, medications you're on, treatments, emergency contacts, and allergies. Whenever possible, don't go alone. Have someone that you can call on, text, reach out to that will be there and meet you there and help advocate for you if you're unable to, or support you. When you are there, be able to speak up, be clear in communicating your needs, ask for accommodations if they are required, know your rights for informed consent, and always, always, always follow up with your primary care. So I didn't want to be talking all that much, but I ended up talking. And now I think this would be a great opportunity to share your stories. So Erica is going to open up some breakout rooms because I'm certain there are people here today who have their own experiences. So we're going to open up the breakout rooms. You're going to be randomly assigned to them. And what we want you to do is share your own stories. Not everyone's going to have this opportunity, but maybe take this chance to tell someone, hey, this is what happened to me, and this is what I did. And let's have a chance to share our own strategies. So Erica?
All right, here we go. The rooms are going to open. If you are in a room with just one or two other people, that is by design. So you have a chance to share with a small group. If you're with nobody else, just give it a moment and I will rearrange the arrangement so everyone will have someone to share their stories with. And you'll have about 8 minutes in these groups. You should see an invitation now on your screen to join the group.
Wonderful.
People are joining in little bits at a time. So just give it a couple minutes here, or a minute.
Absolutely.
Okay. And some people are ending up in pairs. So I'm going to leave that. Just trust the process, Radhika, that some people are in very small groups.
And that's totally fine. And for those of you who are here today, if anyone wants to share their story to the whole group, that's fine. And when we come back, we'll also share some of our thoughts.
Yeah, and in a moment, I'll put a Mentimeter in chat for people who are staying in the main session here. If you'd like to answer in writing, go ahead and answer this question in chat. And in a moment, I'll start sharing results are coming in there.
Sounds good.
Radhika, I'm just going to take over your screen sharing to
Absolutely.
share, just so if people are just sort of coming back to their computer right now, that they can see that we have small groups going.
Totally fine.
Yeah. And if the answers come in on the Menti, there's a Menti in chat. If you want to share, if you do not want to be in the small group discussion, then you can answer the question clicking on the link in chat.
And I appreciate that, being in this position can be challenging. It's not always something we feel comfortable sharing with others. So, yes. Okay. Whoever wrote that first one, you don't obviously have to say who you are. I feel you. I have the same issue. I'm dealing with similar issues. So, my father had Parkinson's disease, and that's always something I had to do. That's where I learned about creating that chart. I literally had a Excel spreadsheet that I created with all the meds he was taking, and that I had check marks. If it was breakfast, lunch, dinner had to be had before breakfast, any notes, and that's how I learned the value of having a spreadsheet with that. Because unfortunately, he wasn't able to remember all the meds he took, and especially with dementia, that's a challenging one. And it worked in many ways. It also helped him to remember what he had to take, though I did have a medical box, but this is a way. And I honestly, COVID was the best teacher of advocacy, because that's when I learned that I do have a voice and I can make sure my loved ones get treatment, because as we all know, during COVID, they often limited, only the patient was allowed to go into a room, into a doctor's appointment, unless you had a minor. And I was like, nope, I have to go with him. He won't be able to answer your questions. And so you need to let me in the room. So I became very pushy, but I felt and they didn't argue when I said, listen, you're going to ask him questions, and because he has Parkinson's and he has issues with his memory, he's not going to be able to answer them. So you can either get an inaccurate depiction of what's going on, or you can let me come with you. Let me accompany him. And also you run the risk that he might fall. But if I'm there, I'll make sure that he's okay. So advocacy, it's all important. And we have to just learn to not be afraid to speak up for ourselves or for our loved ones.
There's a couple minutes left in the breakout rooms. So if anyone else wants to answer the question in chat, or answer up on what's on the screen right now, it's the way you answer that. The way you get your answer up on the screen is to click on the link in chat. But we will take this down. I'll take this down in like a minute or so, because then people are coming back from the breakout rooms and they had their own conversations. So this is the main stage conversation.
looks great, Erica. But if you do want me to
Okay.
share, just let me know. Otherwise, this is
Oh yeah,
fine
why
too.
don't we, well, in order to have music when people come back from breakout rooms, I will, let me just, do you want music or do you want you when they come back? Do you want to get your slides up?
Sure. I can get my slide up real quick. That's fine.
If you're going straight to slides, we can do that. And I'll
Yeah.
close the room in about 10 seconds. Well, I'll wait till you have your slides up.
Okay. Let me just share my screen. You got it?
Yep, got it. All right, I'm closing the rooms. There won't be music when they come back. There'll be you. I'll let you know when they're all coming back. It'll be 30 seconds from now.
Yes. Sounds great.
All right, here you go. 30 seconds.
The 30
I'll let you
second
know.
timer. Now we need the Jeopardy 30 seconds.
Yes.
I think you should just sing it, Radhika.
There you go.
No one wants to hear that, Alyssa. I've been thinking that the whole time. I'm like, we need to invest in the Jeopardy theme song.
All right. Radhika, everybody's back in the main session. So you're on.
Oh, well, that's great. Thank you guys so much for coming back. I hope you found that helpful to just share your stories and what you've done in the past. This is like I said, this is a very intimate sometimes conversation to talk about these things because, it's not always easy to share when we've had to do this and when we have loved ones or people we know who are dealing with chronic healthcare needs, because to advocate, you feel like you have to put yourself out there, and that can be challenging. And I can tell you, I may sound like I'm very confident at this, but I've had my own challenges. About 6-7 years ago, I had a kidney stone and I didn't realize what was going on at the time until I was just in so much excruciating pain. And stubborn person I am, I didn't want to call an ambulance. So I took an Uber to the ER. First of all, never do that. The Uber driver was convinced the entire time I was going to throw up in the car. And I think that's why my rating is not good anymore. But yeah, I got there, and because I walked in, first of all, I didn't get prioritized. I was in immense pain. I was so disheveled because I rolled out of bed. So I think I looked also homeless, which is not an excuse, but I looked homeless. I looked awful. And I kept saying, I'm in so much pain. I'm in so much pain. Please, please help me. And I ended up waiting for like a good 2.5 hours easily. It was awful. And I ended up calling my husband, and he worked in the city. So it took him a while to get out there. And he had to advocate for me because I was in tears. I was crying. I was like, no one cares. I might as well just leave and go home and die. I mean, I was really, if you've ever had a kidney stone, it's excruciating. And it wasn't until my husband came and he was able to kind of speak on my behalf and explain to him, listen, you need to pay attention. She is not only in pain, but she has an underlying healthcare condition. And then he ended up reaching out to my doctor, who luckily their office was right across the street. And he had to actually come over and say, what are you doing? Why is she still in the waiting room? It's now been 3 hours. And he was the only reason I got stuff done. But it happens. So since then I've learned, and I'm like, okay, first of all, don't take an Uber to the ER. If you're in that much pain, take an ambulance. And again, have someone with you who can talk and advocate on your behalf. And so if you have any stories, I would love to share them. And if you've used any of these strategies, I would love to hear about them too. So Erica, if you could pop up that Mentimeter, that last one, we just would love to hear if you want to share any of these that you've done. I know some of you have mentioned bringing like a binder and a medical, having a document, but I just would love to hear if there's anything else that we haven't considered, because we all have experiences that have helped us along our way. So if there's something you'd like to share with the group, I'm sure we would all be grateful. And I can tell you, my friend Ginger isn't here, but my friend Ginger, who is the president of the Sickle Cell Thalassemia Patient Network, has even gone so far as to say, you know, sometimes you have to go and know who is the head people of your institution that you're going to and complain to them. You know, so she knows certain names of institutions and how to ask for them. I'm trying to remember, Alyssa, I don't know if you remember the term she used. There's a certain person on call that you can ask for in the emergency room if you're not getting the care you use.
The
Do you recall?
ombudsman. The
The
ombudsman.
ombudsman, yeah.
Yeah.
So there are people you can reach out to if you feel like you're not getting care. So, oh, great. So yes, be the squeaky wheel, absolutely. A business card, that's another great idea to have with you. That's a small thing that you can have. Some of us have a little more details that can fit on there, but that's great if you can have that. Yes, yes, on your phone. Actually, for those of you who have Apple devices, which I think is a lot, there is a part on here. There's an app on here where you can add, it's health. If you go down to your settings, there's a place called health where you can add all that stuff there. But yes, being able to access your electronic medical record is great, and knowing how to do that. A lot of us who are in big medical institutions have access now, so you can be able to pull that up. But I think I love having a prepared pitch. Yes, it's almost like what we learned having when we were talking, how do you explain what genetic counseling is for those of us who are genetic counselors? Have a pitch. So have a pitch. Learn how to explain what you have in simple language, but that's effective and to the point. You know,
Radhika, we had an interesting issue raised. If your medical condition has led you to more than one health system across state lines? And it's true, if you have a portal, you can use your local, you know, your primary health portal. But if you have several and you're in the ER, you know, that's an interesting challenge.
That is. And that's why I think sometimes it's helpful to have, like I said, some sort of document that has like those basic points. Like, this is the diagnosis I have. These are the primary places I've gone. So you can access their medical records and I give you permission, you know? But if you at least have the type, your diagnosis, and if they question it, sometimes you just need to have a copy of your testing. And I wish that wouldn't happen. And I've been there where people have questioned, no, you can't have that. Because I have a condition that used to be fatal in childhood. And people are like, no, that's not what you have. I'm like, trust me, it's what I have. And if you speak knowledgeably enough, they get it and they'll listen. But oftentimes it honestly is simply, they just have not ever experienced it. And you could say, I will be the person now. So next time you run into someone with this condition, I hope you'll know what to do. Right. And more times than not, I think medical professionals, once they kind of just take a step back, are willing to learn, but you have to prove and you have to show that you can explain it to them. But you have to listen. That's where I think cultural humility that we spoke about yesterday in Alyssa's session is so important. I think on the professional levels, we have to understand that, yes, we are here to provide care, but if it's not something we're familiar with, we have to be humble enough to say, I don't know this condition. I've never seen it before. I've never, encountered someone with this, and be willing to appreciate that the patient, the person in front of them, is the expert, because this is their life. This is what they've had to deal with their whole life. And so they know more about it because of simple experience. But again, having a pitch and having quick references that they can use to feel like confident, like, well, I need to be able to look this up and say, okay, great. Here's Medline, here's where you look, or here's CDC, or here's NORD. Here's some quick information that you can have. If you want to just confirm what I am telling you, here's where you go. But if you have a copy of your diagnosis and the lab, they can't, I shouldn't say they can't, they will less likely question that. That's why I say, if you have a prepared document saying, this is what I'm taking, this is why I'm taking it, all the clues will come together, and hopefully it'll save you time, and it should save them time too, that they don't have to go down this crazy rabbit hole of trying to figure out what's going on. They say, okay, you have I think Aaron had brought up like OI, you have osteogenesis imperfecta. Okay, you are at risk for breaking bones. We need to get you right into imaging right away and figure out what's going on. And we need to stabilize this. And we also have to realize that, wait a minute, we can't stabilize you the way we would stabilize any other person with a broken bone. So we may need to, yes, this is the case where we do need to call the specialist.
I just want to also just go back, Aaron Carter made this great comment of reminding us as genetic counselors that we are, always in a position to advocate for our patients. But I think part of that is recognizing that the information we give them, that we can, not just for their clinical guidance, but to say, you are a teacher, and to give them, and just as a quick story, this is, a dated story, but many, many years ago, I met a young woman who clearly had hemophilia factor 8. And she'd go in the emergency room and they say, you can't possibly have hemophilia factor 8. And so I taught her to say, have you ever heard of the lion hypothesis? And they would say, we don't know what you're talking about. She'd say, well, go look it up. So I think that we can offer tricks to our patients to help them gain confidence that they can go in there and say, as you say, Radhika, get the lingo, and
yeah, exactly.
Once, and it's really, immigrants do that all the time. They learn the word and they say it, and then we think they understand everything. So we need to teach our patients who need that help, maybe some key lingo words. So
100%. It's really important to be able to speak it. I can't tell you how many people have asked me, are you a doctor? And I'm like, no, but I play one on TV. But I might as well be one for the amount of time I've had to spend with medical professionals.
Yeah.
Cindy, I'm sorry, you had your hand up. So you were asking about changing your name with the lab. Ooh, that I'm not sure if I have the answers. That's the question you were saying, that it has.
Yeah, my diagnosis has my maiden name. And believe it or not, I actually had a provider say that it doesn't match your name, we can't put it in your file. And I mean, for me, it wasn't an emergent situation, but I mean, for someone else, it absolutely could be. Wow, I laughed, yeah. But anything's possible, I guess.
Only thing that seems clear to me is like you could staple a copy of your marriage certificate to it whenever, because I have a lot of name.
So, like,
I have a lot of name issues too, but yeah.
I mean, I don't know what testing needed to be done to make that diagnosis, if it was expensive or it's a simple lab test, because if it's something that is I shouldn't say inexpensive, but is a reasonable price, perhaps it's something you can do confirmatory testing again now that in your new name, you know what I mean? Just so that there is nothing. But if that's not possible, then I don't know. That's a great question. I don't know if anyone here, Luba, if you know any
I just
tricks.
thought it was hilarious. And I mean, the other part to it was she said it was 13 years old. It's genetic. It's not going to change, like just put it in the file.
Isha wrote in the chat that you might be able to reach out to them and ask them if they can reissue a report with your new name. And like Alyssa said, maybe give them your marriage license, document, a copy of it, and say, listen, this is my name now. People aren't going to believe me. Can you correct this? What I did, by the way, for that reason, Cindy, is I kept my maiden name as my middle name. Honestly, for one of the main purposes was because I knew I had medical records that wouldn't translate over if I switched last names. Wow. I don't know how I was smart enough to figure that out back then. It was just, but I also I was the only child and I wanted to keep my dad's name. But I said, I have 20 odd years of records with one last name. If I switch over, what's going to happen? So maybe you need to bring your maiden name back.
But why should she do that? I mean, the system should adjust. That's what annoys me.
Yeah, not
it's
that
so
absolutely right. You're absolutely, but that's why I made it my legal middle name for that reason. It's on all my stuff because I was afraid of something like that happening. But Isha's right. Maybe you can reach out to the lab and say, "This is my new name."
Yeah, I'll give it a try.
Yeah.
I just
let us know if it works.
Yes.
Yeah, please do.
I will follow up.
Yeah.
I just thought it was so wild. I mean, it's genetic. Do you think it's going to change?
Well, that is a misconception that we've heard. So
Yeah, we need to have this provider have a conversation with them and say that doesn't work like that. They don't change. But anyway, I see we're out of time. So I just really quickly wanted to share my very last thing, which is just some quick final thoughts. And again, thank you so much for spending some time with me today. And I just want to remind you that self-advocacy takes patience. And I promise you, it becomes easier over time. And you just have to remember to be proactive, be informed, and be assertive. And if you do those steps, that you will definitely feel more empowered when you're in an emergency room situation. But at all costs, please keep calm. Keep calm, keep your head on you, whatever you can, and advocate for yourself. Please don't be afraid to do that, because this is your health after all. So thank you for spending time with me today. And I hope this has been helpful.
thank you, Radhika. Have a good day, everyone.